Hi, this is QD Clinic. I'm Jack Cush with Room Now. QD Clinic is brought to you by Room Now Live, March 20 and 21. In 2021, how's that for a coincidence? A live meeting in Fort Worth or a virtual meeting streamed to your living room. Today's case is not a case. It has to do with what do you do after you're vaccinated? What COVID rules apply? There's three issues here. First, what do you do when you're getting the vaccine? And this is your guidance for your patients who are healthcare workers, your patients who are lucky enough to get on a list to get the COVID vaccine, and it also applies to you after you've received the COVID vaccine because, yes, we're all getting the COVID vaccine because it is the right thing to do, correct? I see you all nodding up and down. Thank you very much. So rule number one, what do I do with my therapies when I'm getting the COVID vaccine? The rule is you continue all your therapies. There's not a drug that you need to stop, nor hold, nor wait, nor delay. Anyone who says that doesn't know what they're talking about. There's only one drug that you need to be wary of, and that is rituximab. And that means that if you're getting the COVID vaccine, get it before you get the rituximab. After you've got the 2 doses of the COVID vaccine, 2 weeks later or 4 weeks later, you can then resume your rituximab. If you recently had rituximab and you want to get the vaccine, you have to wait at least 6 months until after the last dose of rituximab. Otherwise, you don't change your therapy. And by the way, this is also a recent NPF, National Psoriasis Foundation guideline on how you should manage your biologics and or DMARD therapy when getting COVID vaccine. Their guidance number 4.6 is exactly what I just told you. The ACR task force is going to have an update on how we manage COVID vaccines. That's coming out in the next few weeks. Watch for that. I think it'll be very helpful to you in guiding your patients. All right, so you are the proud recipient of 2 doses of the COVID vaccine. What do? Are you take off all your clothes, run around, hug everyone, sloppy sort of kisses and stuff like that? No, you don't. The CDC has come out with a rule because you don't know, while you're going to be protected, most likely, right? 95% effective. You could still get infected. You could still pass on the COVID-19 SARS-CoV-2 virus to someone else, even though you are protected against it. So you still need to practice the same COVID measures. Continue to wear a mask, avoid congregate settings, social distancing, and hand washing are still in play for you. There is an element of freedom for you, but you still have to work hard at protecting other people. Moreover, you have to continue to be an example because this pandemic and all that has changed is going to go on for most of 2021. The last scenario is what happens in a patient who actually has been infected and now wants to get the vaccine. So this happened just today in my clinic. This happened to a colleague of ours. And the rule is from the CDC is that you should wait 90 days. I think you can wait 60 days and then do it. And why is it 90 days or 60 days? Because research thus far has shown of patients who have been infected with COVID-19. And by the way, this should be a proven infection, proven by PCR, proven by a classic constellation of symptoms. If it's not a proven infection, I wouldn't count it. But proven infection, they're protected for 90 days, meaning research thus far, we got 300,000, 360,000 patients who died so far with this and millions who've been infected. The data shows that in the 90 days following infection, after the resolution of infection, no one's been reinfected. So that means that there's a temporizing period, a period of latency where you're not going to be at risk. There are reports of patients who have been infected who have gotten reinfected. So again, waiting 90 days, then getting the vaccine. I personally would wait 60 days and get the vaccine. Other than that, there's no other science to this particular recommendation, but it is good to know what the CDC and other infectious disease specialists are saying about that scenario. I'm sure there are more scenarios. We'll pick them up in future editions of the QD Clinic. Talk to you next time.